Okay, today we're doing a testimonial with Teresa. And Teresa, can you share with us and let us know why you came into the office?
Sure. I had an inability to lose weight. In fact, I couldn't lose weight at all, even though I felt I was eating right. I was working out with a personal trainer 4 times a week for a year with no change in my weight. I was cold all the time. Even in the summer, I was wearing sweatshirts, turning the car heater on to get to work. I also crashed every afternoon about 3. I had no energy.
You'd crave sugar? You told me
Yeah,
that?
I did.
Yeah.
I craved sugar
Okay.
all the time, although it really didn't help when I ate it, but I did eat it.
You still wanted it.
With no improvement in the way I was feeling. I had shared this information with my physician who tested me and said that my thyroid levels were normal.
Right.
But this truly didn't make me feel normal. I wasn't feeling well, and I want to lead a healthy life, and I want to lead a long life, and I felt I needed additional help.
Right. And I'm really glad that you brought that up, Teresa, because a lot of people are told that they don't have a thyroid problem, even though they have classic thyroid symptoms, which you're classic. Couldn't lose weight, felt tired all the time, and also felt cold. That's like classic thyroid. So we did a little bit more in-depth, more specific, and more comprehensive testing, and we also use a different laboratory range, which is a tighter range that'll find a lot of subclinical thyroid issues. So we found that you had that subclinical thyroid issue, and in your case there was an autoimmune component to it, which is extremely common with thyroid. We started you on your program. We addressed your autoimmune, changed your diet, and did some other things. And as a result, what have you noticed with your program so far?
Well, I think it's been pretty dramatic. My energy level's up. I don't crash at 3 p.m. anymore. I have a lot of energy to go into the evening, to go on hikes after work, which I think is really wonderful. I'm not cold anymore. That's great. And probably the best thing of all is that I've lost 20 pounds so far.
Yeah, yay,
And,
that's awesome.
So I'm feeling really successful.
Yeah.
And, and other people are noticing it as well. They've noticed the change in me, which just helps to reinforce what I'm doing.
What you're feeling, and people are saying, hey, you look better, and you're able. And I think you mentioned to me that your work level got really intense the last couple of weeks, and you've been working 60, 70 hours a week?
I have.
And you're able to do it. I mean, you might be a little tired, but you're doing it, you're hanging in there. But prior, if you wouldn't have been on this program, what would have happened?
I would have gone home and crawled on the sofa and not have even eaten dinner unless it was brought to me. And now I'm going home, still making dinner, eating it, but also being able to stay up and read and do some evening activities. And I'm sleeping well. So it's really been a huge change for me, and I really appreciate the difference that we've accomplished with my health.
I think when you first came in, you said that if things didn't get done after about 3 p.m., they weren't going to get done because you ran out of energy at 3 p.m. And now you have energy throughout the day, and you can do things that you couldn't do. So that's some great wins. And we get great results with people who are trying to lose weight. But what's different about what we do is we are digging deeper than the typical medical doctor is doing, and that's why we have the results that we do. And Teresa, if you knew somebody who had a chronic health condition and/or had stubborn weight issues, would you recommend our office?
Oh, I certainly would. This has been an individualized program, and it's you adjust my program with me every time I have a visit, which I really appreciate. So this just isn't a one-size-fits-all program.
Exactly.
It's tailored just for me.
Exactly.
And I think that's why we're getting the success that we are, because it's just for me.
Right. Very good. Thanks so much for sharing.
Sure.
Take care.